Yeah, can you hear me now? Hello, everyone. Good morning, and welcome to this session we have today on air quality management for multi-sectoral action. I'm Priya Shankar from Bloomberg Philanthropies, where I lead our air quality portfolio for our environmental programs. And it's been fantastic being here the last couple of days and hearing from all the government representatives, civil society participants, experts that are here talking about how we can advance action and address this huge challenge around air pollution that we're all facing. And a huge thanks to Heather and the WHO team for organizing and convening us to really drive the agenda forward. We've heard this all before over the last couple of days, but I just want to share a few top stats on why it's so important that we're talking about air pollution and air quality management for multi-sectoral action. We know that nearly all of the world's population breathes unhealthy air. We know that over 8 million deaths are caused by air pollution each year, and it's now the second leading cause of premature deaths. We also know, according to the World Bank, and we have Christian from the World Bank joining us later to speak, but we know, according to their research, that the economic impacts of air pollution cost the global economy $8 trillion, or more than 6% of GDP. And this is from some research they did a little while ago. I think they might have some updated research they're launching this week that I'm interested to hear more about. And we also know that it's critical that to be able to address this, we need to develop effective management systems, and we need to have the data that underlines that. Our founder, Mike Bloomberg, likes to say, you can't manage what you can't measure. But building on the data, we also need to be able to have the governance mechanisms, the action plans, and the coordination across different agencies, because there are so many sectors, whether it's transport, industry, power, waste burning, agriculture, household heating and cooking, so many different causes that kind of moving the needle on any one of these sometimes doesn't address air pollution fully. It needs action across all of them, and it needs action across different levels of government, different governments working together, and other agencies. So that's why I'm really excited that we have a fantastic array of speakers today. Initially, some short presentations and keynote speeches, and then followed by a panel discussion. So for our first set of key speeches, I'd like to invite from the World Bank, Christian Peter from the World Bank, who is leading some of their work in South Asia, in their South Asian practice around environmental issues. Then Martina Otto from the Climate and Clean Air Coalition, who has been doing fantastic work across a number of different areas. If you both of you want to come on stage, and then we can just do the speeches one after the other. Heather Adair Rouhani from the World Health Organization, who are our hosts today. And then also, finally, we have Professor Michael Krishnowski, who's a visiting professor at Imperial College London and brings a lot of incredible health expertise. So if we could have you all up here. And then with that, I'm going to first invite Christian from the World Bank to kick us off with a presentation on the work that they've been doing in the South Asian and Himalayan region, after which we'll have time for, after each of these, some questions from the audience as well. So over to you, Christian.
Okay. Yeah, good morning, everybody. For those of you who came to listen to Benoit Bosquet, I need to disappoint you. He works on Latin America. There was a miscommunication in this respect. So now you have still the time to leave the room. You have to work with me. And if we could start the presentation, I'm going to talk a little bit about what we're doing in the World Bank on exactly this, which is the multi-sectoral approach that we're taking into the, does it come? Yeah, I have given it to them. La presentación que les di? Sí. So just sort of in order to kick us off, really, the South Asia region has some of the worst data in terms of air pollution. If you look at some of the economists sort of looking at the worst living conditions, 9 out of 10 of these cities are highlighted in the South Asia region. Is it coming? Okay. So what we are, and sort of just a couple of takeaways on this one before we're getting started with the presentation, is that I think we have really done enough in terms of analytics. What is really important now, and this is also what our flagship report, which we launched yesterday, in one of the yesterday's session has been, is really that we need now to really move into action. So this is what we're really trying to do, and in order to do so, here is some of the data that many of you know. It has been pointed out in a number of presentations already over the week. This particular area, the Indo-Gangetic Plain and Himalayan foothills region, is really a air pollution hotspot. And what we are really trying to do is what we have tried to frame in the phrase of 35 by 35. So we really want to use towards 35 micrograms per cubic meter by 2035. And this may not be an ambitious target, because in many of these jurisdictions, these targets are already in law, these are already in the regulations, but the implementation has been more difficult. And so what we can actually show is that 35 by 35 is possible. The examples that China, for example, yesterday presented is that it is possible, and it really is something that require a long-term action, and it require bold decisions and investments. What we have done is we have sort of a three-pronged approach. We have done the analytics. We are currently preparing investment operations that are multi-sectoral. They are led internally by different global practices, different sectors in the World Bank. Environment, where I come from, is either leading or is co-leading or is supporting these different areas. But what we really can see is that we have 4 major sources of this, and this is the cooking in households, the agriculture, the industry, and transport. And the 5th one is municipality waste burning. So we have these common measures, and now how do we move into this one? The other important finding which we have is that you can do only so much in your own jurisdiction. So it is not something that you can do on your own. You need to work with your neighbors. You need to work with your neighboring country, because the wind doesn't really care where you sit. It really provides this. And I think therefore we look at this as an approach that really goes across these different jurisdictions. And what we can see here is just an illustration of how much you can do on your own. This is the red for Haryana in India. This is the red line is really how much you can reduce if you're doing it only within your own state. If you then use common measures that happens together with your neighbors, then this is the green line. This is where you can get. And then if you implement all measures across the Indo-Gangetic Plain, this is where you would end, or where you would reach the 35. And this is the area we're looking at. So we're looking at 12 jurisdictions, starting in the east from Bangladesh all the way to Pakistan, Punjab. We're also now adding maybe another one, which is KP. I always get this wrong, so I'm using, it's further north in Pakistan. How are we going to do this? It's a 3-pronged approach. First of all, we look at policy, we look at look at governance, we look at enforcement, and we look at monitoring. And this monitoring is a continuous effort that needs to be done. It cannot be a one-off. It needs to be. It has so many different things. It has capacity strengthening, policy enforcement, and regulation. So that's the first pillar. The second one is obviously the investment, and these investments need to target those particular sectors that were highlighted having the biggest impact. And then third one is what I said before, is then we need to have really sort of collaborative action, how we at least be able to share comparable data, how we can monitor, how we can ensure that any action that happens on one side of the border, even within a country or between states, between countries, can actually have the impact that we want to achieve. So this is I don't want you to sort of focus on the specifics, but it's this three-pronged approach. So you have the advisory and analytical support, which we have now. We are now moving into the implementation stage, and it is important to recognize that it needs to be long-term. So we're thinking currently with the governments, and we have some representatives from Punjab here, on a 10-year or longer engagement that we're looking at. So it can be one-off, here's a project, implement the project, move on. It needs to be something that is really long-term, it's sequenced, it helps us to set up the right foundations and then start with implementation. And then we really try to, with this, all of this, we really try to look at the regional outcomes that we can achieve with this. Very important, 2/3 of the investments need to come from the private sector. So I think one of the issues which we're also working with countries on in countries is, as an institution, working with our private sector colleagues, working with our guarantee projects, coming in with new instruments that really help us to move the needle, bringing in the private sector, so that we have solutions that really helps us to move up this S-curve for technology adaptation, providing the necessary support in this. And again, the other issue is that we as an institution can only do so much. We require the collaboration, we require partners, from the private sector, from sovereigns, and we really are able to do this only together. And then the final thing, and this is sort of important for us, and this is my last slide, it is about communication. I think if we don't get the message right, and we don't get the message to the audiences, to different audiences, we cannot have one message and saying we're doing this and this will achieve this one. We need to cater to different audiences. We need to cater to those people who suffer the most, and they need to understand that there is something happen that will affect them. But this is not going to be a one-off, a quick win. This needs to be done, and it needs to be sustained. And therefore, much more detail, but this is where we are at the World Bank. Thank you very much.
You can really stay there.
Okay.
Because we've got, I'm just going to come join you there, if that's okay.
Sure.
We could do a little tag teaming. But yeah, thank you so much, Christian, and particularly interested to see the example that you had of Haryana, because at Bloomberg Philanthropies, we've been collaborating with the World Bank and supporting work as part of a technical assistance partnership in support of the Indian National Clean Air Program in the states of Haryana and Uttar Pradesh. But some really interesting key takeaways that I took from you were the importance on a long-term focus, regional and international collaboration, and across boundaries and communication. So thank you for that and for being brief. But with that, I'm going to open it up to some audience questions. I think maybe we have time, because you were so good at staying on time, I think we have time for 2 questions if anyone is wants to kick us off. If not, I'm happy to. If not, I'm happy to ask a follow-up question, but wanted to open it up for the audience first.
And I just wanted to make sure that you know that I'm only here to present this. I have my team is here, so they can also, then they will be around. So you can also, no, but I want to say is like, we're here, and we had a conversation yesterday on the flagship report, and what was there is like, if you have any question, if you want to join us in this, come in. This is sort of something where we don't take any credit for ourselves. This is a joint agenda that we need to take together.
Yeah, go ahead. Yeah.
Thank you very much. Great presentation and great work to you and your teammates. You had mentioned the different communications you have to have with different sectors and how to include private sectors in this conversation as well. How much, when you're talking to private sectors and businesses, how much of health aspect do you bring in, or is it just the numbers and economical part that you make the deal you talk about?
No, I don't think that the numbers will be any good message. I mean, I think for the longest time we have the numbers, and where are we? We're still increasing. And I think the point is that even the 35 by 35 is a catchy kind of phrase, but I do think that the situation has now been so bad that I do think that everybody is waking up. And I think that what we found in the consultations that we have, and we're going to the board of directors with a project in Punjab, in Pakistan, Punjab, this week, and then we have the next one in Bangladesh, is really that the private sector is coming to us. The private sector is saying, okay, so you have all these findings. How can we help? Because our own workers cannot go to work. Our own children cannot attend school. That affects that if I'm being told my child cannot go to school, I need to find a way of how do I take care of this child, or how do I pick my child up from school, and that has an impact on the private sector. So I do think that there is a real momentum at this point in time, and we take this into account. But at the same time, as I said, we can't have only these lofty targets. We need to really drill down and really need to come from, there are regional agreements, but they needed to be implemented at local level, because that is where it really hurts. And that's where what we're really trying to do.
Thank you so much, Christian. One last question, yeah.
Okay, I have the microphone. Thank you very much for this interesting presentation, Andrzej Guła from Polish Smog Alert. You mentioned that among two major sources of air pollution is cooking and cars. I would like you to elaborate a little bit more about the concrete and specific policy actions that are already in place right now to tackle these two major sources of air pollution. So the cooking that requires mass-scale replacement of the stoves, I assume, and cars. So if you could tell a little bit more about the regulatory or financial actions that are already in place right now. Thank you.
So one of the things, and I think also which we're finding out, which is very important for us, is that in the dialogue we can't sort of, again, coming from these lofty findings and going down. I think we need to start somewhere. And what we're doing, for example, in Pakistan and in Bangladesh, is really looking at, quote unquote, the lowest hanging fruit. And in this particular case, it was transport. So there was a commitment already in Lahore to purchase electric buses. There are policies that have been developed as these fleets are being sourced, being put on the street, to address these different things, charging station, all these other measures that need to be taken into consideration. But it was a transport project, and it didn't really sort of in the initial phases think about how can we address air quality management. And this is sort of where I think we came in as the environment department in the World Bank and said, look, this is really great, but there are so many different things to do. And our partner, EPA of Punjab, they actually have a role to play in this one. These measures need to be enforced. There need to be, the old vehicle needs to be coming out off the street. There has been vehicle inspection centers that have been, according to the law, should have been functional, and they weren't functional. And what happened then, they go to an inspection, they're being rejected, they go back, and then they pass the test. Is this clear why this was? So there needs also to be measures in place that take these badly polluting vehicles off the street. So that's on this. On the clean cooking, this has been, as I showed in the slide, this has been sort of a more difficult way to or more difficult sector to work in, because it is sort of a mixture of, well, not a mixture, it is actually, it really affects every single household, and getting to these households, that's sort of the tricky part of it. We have, however, been very successful in some of the countries, including Bangladesh, for example, to roll out, with the help of some of our SMAP, which is the energy, Sandeep, help me, the energy, yeah. Okay. And so the issue there is that we need also to come in with carrots and sticks, right? Sort of, you need to have some grant financing that helps you to sort of give this first push and then look at different options. It's not one size fits all. And therefore, I think that's sort of where we're working on. It's a work in progress, but I think we are on a good way. And as I said, the momentum is there. And I think the willingness of politicians also is there to really look at these things and see that they're being asked next election cycle, what have you done? And so I think we can come in and can have some of these things. But as I said, it work in other places as well.
Thank you so much, Christian. And next, I would like to invite Martina Otto, who heads up the Climate and Clean Air Coalition, to come speak to us about the work that they're doing in terms of supporting international exchange on air quality management. And it's been fantastic. Congratulations, Martina, to hear about your AQMX platform and all the ideas that that's exchanging. So look forward to hearing more about your work.
Fantastic. Thank you so much, Priya. Sorry. Okay, here we go. Thank you so much. And maybe just to start, obviously everybody who has listened to me yesterday evening, for example, knows we are about the nexus between climate and clean air. And we have really started out with a scientific report that gave rise to the creation of this partnership of over 200 countries, civil society organizations and IGOs. And we our scientists went through over 2,000 air quality measures, checking them, how well they were doing for climate purposes as well. And then they broke it down, looking at where do we have known proven technologies that we can just roll out, in a sense, and that were relatively low cost. And we derived out of that 16 key measures. We then did these reports per region. And we did the first one for Latin America, the second for Asia Pacific, and the third for Africa. And the African one had, in the end, 37 measures, because we also optimized for sustainable development objectives more broadly. But those 37 measures are across 5 key sectors, and there's a good overlap with what we heard from the bank. But that's in addition to household and the energy production. It is waste, agriculture, and transport, just to highlight that as background. Now, we have, you know us, I'm sure, a lot for the work that is being done on methane. Methane really got high up on everybody's radar. And I just want to hold the thought as well that methane is absolutely critical for folks dealing with air pollution, often not really looked at. It's a precursor to tropospheric ozone, and you know that. And this community is looking at tropospheric ozone, but not what is sort of behind it. And I think there's something, a click that needs to happen as well. Just want to hold that thought too. Because obviously there's these interactions are super critical as well for health in a wider sense, tropospheric ozone directly, but also indirectly through the food security aspects, because it does impede plant growth. So I just want to hold those thoughts and show these multiple interconnections that make the picture maybe a bit more complicated and blurry, but I think it will help us, give us more reasons to act on these issues. Now, because we had all this effort on methane, we really decided as a group that we needed to give a strong emphasis on the clean air side of things. We created a clean air flagship that has 5 sort of key strands of work. And one of them is linked to addressing what we found was a key barrier to action in the sector is capacity. So finance is the first big barrier, but what came out was capacity being the second. So we went ahead and developed the what is now known as the AQMX, Air Quality Management Exchange Platform. And that was developed with an amazing team of people. So it was collective wisdom in the room that helped us to develop this in a very good time. And a number of people who are in the room here were part of that process as well. And what is it? It's a one-stop shop for air quality managers to get immediate information on what to pay attention to, how to do certain things, and to look into, there's a whole resource library that comes with it as well, that gives indications on what has worked somewhere else. It's linked to training opportunities, so it's not a platform that sits on a website and is silent there. We run training events around this. What we have done at the moment is stage 1 guidance, so that's really for those places where there's not much in terms of air quality management in place, to really help them get things started. Over this year, we do stage 2 and stage 3, so we'll complement that, going deeper, becoming more sophisticated as well. We will also complement this with a regional exchange, and that takes me to another thing that we have set up, and that's the Africa Clean Air Program. So to help, because that's the region that doesn't have a regional sort of framing for things, and so that helps us drive action there as well. Maybe I should go one step back to the Air Quality Management Exchange Platform. What is in there is really around 8 key areas, the how-to. And one of the how-tos is on monitoring. So it's not giving you the data, how bad is my air quality in a place, but it gives you, how do I go about monitoring? Gives you this guidance. What do I need to have in place? How do I really have the capacity? So that's a step. The standards as well, looking at model regulation, for example, and how can you actually take it to your specific context as well. How do I do the assessment of multiple benefits? How I do the assessments of the health problems that come? So it's those kinds of things that are included there. Is this my being to stop, or?
Wrap-up sentence, but yes, I think wrapping up soon, yeah.
Okay, good. What I wanted to say as well, so we have that AQMX as a tool, but we have our sector hubs. So we do take action across the sectors. They gather a lot of partners that have an interest in this field. We look for positive tipping points, how to move that sector, and we have trust funds for which we fund projects, and we have done quite a bit of work at the national level. So with Cambodia, for example, looking at their air quality, their clean air action plan and implementing that, supporting Uganda in developing an integrated national clean cooking strategy. So that's a key point. We do things at the regional level. We have done a regional approach to prevent open burning of waste in Latin America, in Africa, and in Asia. We've done work on brick kilns across all those regions as well. And maybe at the global level, to mention, we've done a global sulfur strategy, so that really looks at this interaction between vehicles and fuels to actually drive us to something that's cleaner. And so that gives you a bit of a breadth of what we're doing, what we have to support countries. And obviously we work very closely with our colleagues in the WHO on Breathe Life, and that's the last bit on the cross-sector work. So it's the sectors in terms of economic sectors, and it is across the themes, so climate and clean air, but it's also making the most of the environmental and the health community coming together. And maybe I stop with that. Thank you.
Yeah, thank you, Martina. Okay. And I think this is a really nice representation we have from the 3 kind of different international organizations with the kind of economic perspective, the environmental perspective, and then moving on to the health perspective. We'll hear from Heather soon. But before that, I want to open it up for any audience questions, if anyone has any questions for Martina. No, in which case I'm going to ask you a follow-up question on that, Martina, in terms of the point that you raised about capacity and how it's really important to build capacity on the ground, and you found that to be a challenge and a barrier to overcome. what do you think are some of the best mechanisms and ways in which that capacity can be built in a sort of lasting manner?
Thank you. I mean, it is strengthening institutions so that it becomes someone's job. That is absolutely critical. Without this anchoring, it doesn't quite work. It is about having the right tools at hand as well. And that's what we hope to address with the AQMX directly as well. It is, I think I should have started with the political will. Without the political will, it doesn't really quite quite get there either. So those are a couple of key elements that need to be in place for things to move ahead.
Thank you. And very excited as well to hear about the launch of your Africa Clean Air Program. As you know, with the Breed Cities effort that we support together with our partners at the Clean Air Fund and C40 cities, we're supporting work in 3 African cities, Johannesburg, Nairobi, and Accra. And so are keen to kind of explore these multi-level collaboration opportunities from the kind of city to national and regional, and very great to see that regional work kicking off. I would now like to invite Heather Adair Rouhani from the World Health Organization to speak to us about how the health sector can engage and the tools and resources WHO is providing for this.
Great, thank you, Priya, and very nice to see you all. This works very well because my following speaker is Michał Krzyżanowski, who's going to really talk about how the health sector respond, and we're going to talk to you about, I'm going to present what we are doing at WHO to provide the tools to support the health sector engagement. I alluded a bit to it yesterday during the main presentation, but I couldn't really unpack a lot in a plenary position, end of a presentation. So this is a great opportunity to do so. So some things that are critical for the things that we're doing at WHO in terms of providing data and tools and resources to the health sector to engage, particularly in air quality management, relates to the data that we're doing, productions, how we have integrated health into a variety of SDGs that we're monitoring. This was a really key opportunity because, for example, there aren't many other SDGs where you have different sectors clearly working together and to monitor and track those. We also do a lot of synthesis of evidence and this idea of really putting projects in particular areas, and as mentioned earlier by our World Bank colleague, the importance of communication. So data is where we start. We really need to know what the problem is before we can really tackle it. So this is something we really try to do is gather an assessment of what are some of the key air pollutants that are related to health. And this is, for example, why we have guidelines and these things. But first, we have to gather that data to know where the problem is. And then we can actually use various calculations to understand what actual health impacts that relates to. So how does that translate actually into the disease and that we're seeing? And just to flag, it's not only about deaths. In fact, morbidity is really key. A lot of these people are living with diseases for a very long time, impacting their lives. So we see already the 7 million, but really the number of people suffering each and every day from some of these chronic diseases and things is really important to key. So we're really trying to advocate and help quantify that because that's where you get the economic impacts, et cetera. So indeed, we also provide tools to actually use health impact assessment. So you apply this various information, whether it's your exposure and your relative risk, the risk from disease of exposure, and then what are actually the emission reductions in a particular sector so that whether those are local authorities or national governments can really evaluate the effectiveness and where those health benefits are going to be. And this provides the health sector the evidence or the talking points to engage with other sectors such as those in transport, those in energy sector, production, waste management, etc. Oh, is it going backwards? Oh, I went backwards. Oops. Sorry. It's a long morning. So some of the things that WHO specifically collects, and this data is all publicly available to anyone who would like it on our website, is we first of all actually look at the source contributions and what are the air pollution coming from these sources via air pollution monitoring, and then looking at really how we can measure, because the data collection is not of course, universal, as we know. So we do have to apply some various modeling and measures to do so. And this is where we get into, we have a specific reports that really support countries and cities to actually understand and assess the health impacts. And it's important to know where your polluting sectors are, because particularly polluting sectors that relate to health. So we really try to help countries and cities understand if you're looking at, you want to start something to tackle air quality in terms of managing air quality, and you want to ensure health protection, you need to know what are those sources that are really impacting health. Hence, we have this database on source apportionment studies, and we really promote the researchers and authorities to really look at this kind of source apportionment work. We also provide the targets in these kinds of standards. This is really important for setting normative standards within air quality, standards within cities, countries, and regions. And this is based on the air quality guidelines. These guidelines are really a very long synthesis, and this is one of our bread and butter, drives all of the other aspects we do. They took about, and Michal, my following speaker, can talk about it. He's been done through many different air quality guidelines, and he's actually the key of air quality guidelines when it started about. It takes a lot of scientists and epidemiologists, researchers from across the world where we synthesize the evidence, and they take years to develop because they are very, very robust product. So we have this leads to air quality regulations via the air quality guidelines. And there's a nice hard copy at the stand if you guys would like to bring one home with you. And then we take this information and it actually helps define what are the protective measures and help decide how to evaluate those. So you can find more information here online. So some other information that WHO provides. It's not clicking. So it helps us to actually identify particular measures to address ambient air pollution to protect health. These are our compendium, for example, that basically provides different types of solutions and resources and really actually compares them to other environmental health interventions as well, so that countries can really evaluate what's best for them in terms of protecting the best, maximizing the public health benefits from various interventions. Then it's really important, as I mentioned earlier, the Sustainable Development Goals. And we managed to integrate our normative guidance into the way the Sustainable Development Goals are being monitored. For example, as alluded to earlier, SDG 7, where it's the primary reliance on clean cooking fuels and technologies in the home, where clean is actually defined by the normative guidance included in WHO guidelines. So this way, when we have various people developing household energy interventions to roll out on the ground, they know if they're trying to achieve WHO guidelines, that's a set that they're automatically going to receive some health benefits. We also have, for example, integrated this into SDG 7.11.6, which is ambient air quality in cities. We actually take that information, which we collect. We have one of the world's largest databases of nationally reported data and local reported data on ambient air quality. We combine those in to help actually understand the mortality rate attributed to the joint effects of household and ambient air pollution. So countries in the health sector can actually monitor what is that impact on air pollution and how is it really affecting the disease risk in my country. And then we have specific tools and guidance, which my following speaker, Michal, will allude to a little bit more. But these are some specific ones that you can find and where you can provide these tools for your own decision-making locally. We have some more interactive tools, and these tools are used by the health sector, but also for other sectors. And these are things such as that they're available online, for example, that allow countries and cities to really evaluate. For example, AirQ Plus are where you can is a particular tool that's very popular in a variety of regions, and we're always asked for many trainings on this. It allows people to actually estimate health impacts from changes in emission reductions. So people can actually see if I put this policy in place, which is going to reduce health by this much, this is kind of the benefits that I can see. We also have rules, tools and resources that combine air quality and climate change. Those looking at walking and cycling, our heat tool. We have ones that look at the effectiveness of green spaces in urban areas to help evaluate those health benefits. And then, for example, a popular tool that we have is the benefits for air pollution, household air pollution reductions, and the BARHAP tool, which allows you to evaluate different interventions for household energy. Here's a little bit deeper dive into AirQ Plus, for example. We've actually used this and synthesized across to evaluate what this tool and how it can be used across different regions and quantified those. Here's a little bit more about the heat tool. This is how the health benefits from walking and cycling. And we can actually see, so those people really promoting public transport and other aspects in their areas can see what benefits those lead to. This tool is particularly looking at how climate and mitigation and air quality can allow and what those benefits can be to help really allow this country's specific and country level impacts can be estimated. And then we have the Clean Household Energy Solutions Toolkit. This is actually a very long toolkit, so this is a very summary side and includes about, I think it's 6 modules, which really takes the whole walks a country or region or I guess city to actually design and implement and monitor policies related to clean household energy. It starts with everything from a stakeholder mapping, walks through the development of standard setting, and for example, WHO is a Category A liaison for the International Standards Organization on TC 285 for clean cooking, so that allows local authorities, and we can support them, develop their own clean cooking standards. It also talks about also provides exactly this cost effectiveness analysis to evaluate 12 different interventions in the household and other things related to communication. So we have great training videos on each one of these modules and really recommend you check it out. And then, as Martina alluded to, we also work on terms of the importance of communications and this Breathe Life. As you may have seen, the pollution pods last night is one way we're really advocating for how letting people really feel and communicate and understand health impacts related to air pollution. We also have a really cool gauge. When you put in your city name, it goes, and depending upon your air pollution level, which I highly suggest you check out. So in conclusions, we really are working to provide those tools and resources to help the health sector engage. And as we'll hear more on how the health sector can engage, we are here to provide that bread and butter for them for those intersectoral discussions.
Thank you. Oh,
that's fine.
Okay,
and then it's
so
just, yeah, this is what we can do. So yes, over to you.
Okay, thank you so much, Heather, for outlining that wide array of tools. Incredible. Just wanted to open up and see if there's any audience questions for Heather. I think we have time for one question, maybe. No? Did you see? Yeah. Oh, well, I'm going to come in with a question then, Heather, and ask you about, in terms of these tools that you have outlined, it's really fantastic to see. Are there kind of particular areas where you sense the most demand and the most interest from the stakeholders that you work with?
Sure, there are definitely ones. Like I was saying, AirQ Plus, my gosh, we just do not have the capacity to respond to all the requests at city level, country level, region level. That's a very popular one, and I think it's very easy for people to use, and it provides that quantification, and there is a nice interactive tool on the web. I would say another tool that's really being commonly used related to household energy is this BARHAP tool, the Benefits for Actions to Reduce Household Air Pollution. And this tool really has been helpful for the energy sector specifically. We're really trying to roll out clean cooking solutions because they can evaluate, but they provide the economic argument as well. So they really accounts for the health, climate, and economic impacts to the government, so the national government, as well as the individual itself, and helps you evaluate and accounts for other things like time saving, time loss, and other things like quantification.
Thank you so much. And now we will hear from Professor Mikhail, bringing in a lot of health sector expertise and experience as well.
Thank you. Thank you for having me here, even though I'm not on the pictures here on the slides, but I am in the app. So anyway, I will talk a little bit on the subject which Heather was addressing, but I try to address it from different perspective. And to do so, I would like to ask, who of you is actually representing, belongs to the health sector? Who is a medical doctor or public health specialist? Okay, good. Not too many. So you see, in air quality management community, health profession is a minority, but I would say important minority. We also heard today in plenary session from Sao Paulo, mayor person responsible for environmental policy, that he or his colleagues need support about communication. Is very important to communicate why we need all this investment, all this effort, and sometimes change in lifestyles in many cases. Well, this where comes health argument. You are here because you know this. You know that we have 8 million deaths per year attributed to air pollution. You know that air pollution is the second risk factor among 80-something risk factors for which we can actually calculate the health burden, that it is important. You know about proportion of very popular, let's say, diseases, very prevalent diseases, which are associated with air pollution. And this message has to be disseminated by health professionals, because health professionals have this authority to talk about health and to talk about the problem we have with air pollution. It was proposed by a Dutch colleague, voila, here, that we should talk about healthy air. Okay, I mean, in various languages it will be different, but the point is that health became a determinant of our action, which was not always the case, action related to air quality. Here is a reprint or picture from one of the WHO documents, which Heather was talking about. This one is about air quality management. There's an air quality management system or outline showing numerous activities related to air quality management. One of them is assessment of health impacts of air pollution. But I would say this green box here is not only assessment of health impact, it's just formulating health message. And this health message is actually setting objectives and targets for air quality management. It's part of the cycle, but without it, the cycle would be not attached to anything. Yeah, okay, to be fair, we do have environmental objectives or ecological objectives. We want to, and in the past we did, try to reduce impacts of acid air pollution on vegetation, on forests, on lakes, impacts of nutrients coming to the air on ecosystems and biodiversity. There are still very valid arguments. But when we try to compare the weight in terms of costs, of also of public perception, health dominates the air quality management, especially in relation to pollutants like particulate matter, which is actually the source of the biggest health burden. How those objectives and targets are set? Well, they are set, we have them. We have them through air quality guidelines. We know which pollutants we should look at, and we know that there are thousands of pollutants in the air. Yeah, but we say, okay, here we have a handful of air pollutants which are of primary significance. Let's concentrate, let's focus on them. Concentration is something else, but let's focus on them. We also have targets in terms, okay, what does it mean focus? How much we have to reduce those pollutants to get to healthy air. I would claim at this moment what would be the healthy air is everything where concentrations are below those in the last column of the table. I mean, those meeting air quality guidelines. And there is still luxury for 1% of population, a little bit far away. But we do have interim targets, and we can say, okay, in so many years we reach this target. And here is a target for air quality management. The first step in air quality management are air quality standards. I mean, this time, these are legally binding standards for a country or group of countries. And here is a screenshot from the map produced by WHO database on air quality standards. A few weeks ago, there was announced launching of this database, which has standards from 120 something countries out of 194 which were visited. Some areas on the map are gray, which means there are no standards, in this case for PM2.5. PM2.5 is the most hazardous, as we see, air pollutant, but only some 30% of countries for which information was obtained has those standards on PM2.5, which means those standards have to be created to force air quality management in countries to address this hazardous pollutant. You can see on this map, you can click each country and see what is the standard. I click, not by accident, Colombia, the standard for air quality for PM2.5 is 25 micrograms for long-term concentration of PM2.5 is 25. There's interim target 2. It's not too ambitious, I would say. There is way to progress, and the health community should use this as an argument to push air quality management to make this standard more ambitious. Air quality database was mentioned by Heather. The data on air quality are essential argument also for health workers or for health sector to say, to compare with air quality guidelines or standards, to say, guys, we have problem here. Yeah, so this data is essential. If you don't have data on certain pollutant, you don't have problem. This is the easiest. Yeah, in some countries it is applied. I mean, if you have a problem, you just remove the monitoring station. Well, you can also break the thermometer and have no fever. This is also a solution, sometimes quite dangerous. Anyway, WHO was able to gather air quality data, in this case on PM, from more than 7,000 human settlements, cities or regions, obtain from countries or get from publicly available data. There is probably more data than that, but you see the map, the global map, plenty of areas with no data points. It doesn't mean the data do not exist, but they might exist, but they are not accessible. So cannot be used by health sectors, by people, also by authorities. This is something which health sector has to call for constantly. We need data. We need to measure body temperature to see if somebody is healthy or not. What medical societies are, let's say, voice of the medical community, and medical societies have been very, very active in this respect. I mean, here is just a handful of public statements by various communities in United States, in Europe, joint US or American, European statements, some statements directed precisely towards a given policy debate. like the policy debate on European policy on climate, actually, but addressing air pollution. So those statements have very heavy policy and political weight. They are representing thousands of medical professionals, and they are being used by policymakers as an argument. So they are important pieces, and I think they are welcome expression of activity of health community. National experts group, more or less formally appointed. Here I just presented a few which are formally appointed, like Committee on Medical Aspects of Air Pollution in UK, which is working for, I think, at least 2 decades, which is formulating assessment for the UK government, where their assessments are taken into account in setting the legislation, actions, and so on. The same, we had presentation this morning from a representative of Santé Publique from France. There is also a committee which is preparing assessments, quantitative assessment. Recent assessment was including economic cost of asthma in France, which appeared to be staggering, I must say. I mean, really billions of euro, I mean 10 to 9 euros cost of asthma disease. Yeah, not death, but disease, treatment, lack of activity of children and parents, cost of medication, cost of hospitalization of doctors and stuff like this. This money, there is an argument which can be used in support of the actions. This argument must be given by medical or health community.
I'm sorry to interrupt, but I'm going to ask you to try and speed up maybe just a minute more to wrap up, if that's okay.
I have 2 slides more.
2 slides, maybe 30 seconds per slide?
Yeah, there is there are also quantitative arguments about the impact of air pollution on various diseases, on incidence of various diseases. And this data is being used, so you don't need to calculate it yourself. You can use, in this case, these are results from Global Burden of Disease study presented in annually updated State of Global Air reports and web page where you can get basic data for each country, or in many countries also several subnational areas. AirQ was mentioned before. This can be used for any community to calculate what is the impact of certain action, what would be the impact of certain action. To do all of this, health professionals, health community has to have capacity to do so. WHO has developed a training course where medical doctors, health workers can get in like 4 hours training course administered individually in various time, basic information on air pollution and health. So in summary, the health sector is providing evidence synthesis, is providing air quality information, I mean interpretation of the air quality information. It's not, should not be charged with monitoring of air pollution, and also training and capacity building is an important part of the health profession activity. Thank you.
Thank you so much. A really strong reminder of the importance of the health sector and the ways they can contribute. I would like to thank all the stellar speakers we've had right now, and we have an immediate panel following them as part of this session, which has a range of stellar speakers as well. So I'd like to request everyone in the audience to stay on stage. Ashwin Vasan from the Harvard Chan School of Public Health, Aoife Kirk from the World Economic Forum, and yeah. Pema Gyamcho from ICIMOD, Kuruda Itsuki from the Ministry of Environment in Japan, and Michael Williams, the Director of Environmental Health in Jamaica. And thank you all for joining us. And we've heard a lot this morning. Sorry, I'm going to stand up so you can sit down. Okay, thank you all for joining us. And we've heard really rich insights earlier about the importance of the health sector, the kind of economic arguments and impacts, as well as how different countries can learn from each other. And I'd like to kick this off by asking Suki from Japan to start by sharing with us a bit of the kind of national experience in Japan about how you're dealing with air quality management and bringing in both sort of environmental and health perspectives together.
Thank you.
Is that working?
Yeah, working.
Yeah. Okay,
working.
great. Yeah.
Hi, I'm Suki from Japanese Ministry of the Environment. So first of all, Japanese Environmental Ministry and Health Ministry share the building. So you can tell how close we are communicating. And also, we have Department of Environmental Health, where I belong to, and we work in integrated manner by exchanging secondees regularly. So I would say multiple division in my department. For example, my division, a third of the staffs are from Health Ministry, including medical doctors. So the reason behind of this is because Japan experienced extreme environmental pollution, especially since late 50s, sorry. And then since 1960s, the government, then the health ministry, specified multiple major pollutions in order to support victims from such pollution financially and also medically. And in 1970, we passed several, multiple environmental bills at the National Diet. And in order to implement those bills, environmental ministry was established in the following year. So multiple function that was started from health ministry, and they have been moved to environmental ministry. Therefore, in order for us to exchange the expertise, the secondment program is the pivotal thing that we need. And also between MOH and MOE, we have regular communication and the liaison meeting. So therefore, I would say that the environmental health nexus is well established. And currently, when we establish environmental quality standard, we examine the available technologies and also the treatment technology of the pollutants, and also conduct interviews with the company owner, the business owners, and also collect information that serve health impact assessment. And then convene the council of multi-stakeholder, multi-sectoral experts for the careful consideration, possibly similar to the UK or the European cases that just been introduced. And additionally, the local government are really playing the pivotal role in Japan. I feel that that's something we have to be proud of, because certain function that the government has to, the central government is supposed to play, is played by the local government. And local governments are allowed to impose more stringent regulation depending on their local circumstances regarding environment and health. And when it comes to pollution control, since they were the initial drivers for establishing stringent standards, taking into account their unique situation that happened in the 60s. So World Bank talked about the local implementations important. We truly agree to this point, because really local government has been the incredible job in Japan. And they were the one that examined their local pollution, such as causes and impact initially, and such analytical functions still carried by each local government with the collaboration with the local healthcare centers. So I would say that health impact assessment has been really important when it comes to the environmental control, and I would say that our nexus have been well established. Thanks.
Yeah, thank you so much for those insights and really interesting examples of how the environment and health ministries are working sort of so closely together and the importance of local government and action as well. Michael, I'd like to ask you now to talk about the experience in Jamaica and how you're approaching air quality management. Oh, this is.
Thank you very
oh,
much.
got it.
Priya.
Great. Yes.
You know, as I sat here, I said to myself, Jamaica speaking about air quality issues, and we're talking about the country with the greatest athletes, some pristine beaches. How could we have air quality issues? But you know, that's how things work. But yes, we have a few challenges, and I'm happy to say that we have received tremendous assistance from PAHO. Dr. Ian Stein, PWR, and his team have really assisted us. And HIA was done looking at particulate matter 2.5 concentrations, and using the AirQ Plus tool, the assessment looked at the concentrations in various towns in Jamaica. And we found out that a couple of our towns had concentrations above the WHO recommended levels. In one town, it was as high as 22 in 2019. And of course, that was alarming. And so when we look at the ambient air quality challenges and we're looking at the sources, of course, transportation is one of the sources. We have at times spontaneous fires from waste sites, and among other things. And I must say that we have sought to deal with this issue in a collaborative way. We have the National Environmental Agency. My colleague is here today, and that does the air quality measurements. And what we did through PAHO was to bring all of the agencies together. We're talking about mining. Of course, you know, Jamaica has bauxite. We're talking about environment, Ministry of Health, and the transport sector. They didn't turn up for that meeting, but we met and we planned how are we going to tackle this problem. And one of the solutions we're looking at is to deal with the whole issue of the transport. And some of these towns are really transport hubs and manufacturing hubs. And what we found out, there was an inadvertent solution because the government decided to put in CNG buses and to divert from diesel. And as I had mentioned yesterday, part of the reason for that was that there was heavy theft of diesel from the buses. And so they decided to go with CNG buses. And they have bought 125 of these buses so far and plan to put in 200 electric buses. And you know, that's really something substantial to really make a dent in the PM 2.5 concentrations. Also, we have formed a committee that will be looking at the various sectors and what can be done. In the past, we have worked with the bauxite sector because as some of you may be aware, where there is bauxite mining, at times there's a lot of dust. And so we have worked with the bauxite sector to do dust mitigation strategies and also to work with the community. In terms of the indoor air quality issues, one of our biggest challenges with healthcare facilities, where we have found out because of the population growth, and we have not kept pace with putting in new facilities. So at the hospitals, you have persons, services being expanded, and the HVAC system that was originally built just can't handle the loads, and then a lot of window units were put in. And again, this created other issues. And so the government is currently building two new hospitals. And again, the air conditioned HVAC system is priority number one, because one of the reasons that they had to close one of the biggest hospitals on the island because of poor air quality issues. The staff complained they were sick billing syndrome. And so has now become a priority. And any other facility that's going to be done, air quality is top of the list. Also, we are encouraging the population to participate. And also, we have advocacy from NGOs and other groups that are involved in the whole air quality issues. At times, we have the spontaneous ignition on the dumps. This has proven to be a problem. And so the government is moving to sanitary landfills, to build sanitary landfills and to do recycling of waste and waste to energy projects. So these are some of the ways that we are looking at improving air quality and preventing the high concentrations of PM 2.5. Also, recently we have been having the Sahara dust, which has become an issue for us in the Caribbean. We haven't found a solution to that one as yet, but I don't know if we have anybody here who could offer some advice, but we're still hoping that we can get some release in regards to that also.
Thank you so much, Michael. Really incredible to hear about your efforts, and congratulations on the bus cleaning initiatives. It's been interesting to hear this morning from kind of international organizations and now from this national perspective. I'd now like to ask Pema from ICIMOD, where you've been working with a number of countries in the South Asian region, about how you approach regional collaboration and if there's ways that you think different countries can work together.
Thank you, Bill. You might be wondering, why this guy has come all the way from the Himalayas, from Nepal to this place, which is very far, not easy to get here. But I thought if we can together make a difference, in extending our life, the lives of those people living in the Indo-Gangetic plains and Himalayan foothills by another 2 to 3 years, or if we can ensure a future for future generations to live longer than what the present generations do, then I think it is worth it, for us to bring this message to all of you here. Imagine now looking at this room. Imagine this is the Indo-Gangetic plains and the Himalayan foothills. We don't have a choice. We are breathing the same air, but we have a choice in terms of whether to drink water, either to drink it in glasses or bottles and so on, or in terms of air. We are breathing the same air. So in the Hindu Kush Himalayas, in the Indo-Gangetic plains and Himalayan foothills, you have heard before, the air quality is so poor that the average is about 10 times higher than the WHO prescribed standard. So we are living with that every day of our life. So the first message that we are trying to work with our partners in the member countries. So we are working, ICIMOD is working in 8 countries that covers the Hindu Kush Himalayan ranges. So the first message that we are trying to give is that air pollution is transboundary in nature. It doesn't recognize the airspace boundaries. So the source could be somewhere else, but the impact is elsewhere. So I think that is the recognition that we are gaining now. The second is that the air pollution, both ambient and indoor pollutions, there are so many solutions already that we have enough information, knowledge to take action. And that is the second message. Third, that we need increased investment to address these solutions, to provide these solutions and so on. And the fourth is that we need to work together at every level, at the community level, at the national level, at the regional level. So in order to do that, we are working together with the bank and other partners like FCDO of the UK and so many others to create a platform. So ECMOD's role is to provide that platform to facilitate the regional member countries, the partners, now covering 5 countries, as you have seen from Christian's presentation earlier. We have Bangladesh, Bhutan, Nepal, India, and Pakistan. So we have already gone through 2 rounds of science policy dialogue. So in 2022, you have seen from Christian's presentation, we met in Kathmandu and came up with this roadmap to set an aspirational target of 35 micrograms of PM 2.5. Now that is an aspirational target because we know that some countries, some members are doing much more than that, or more ambitious than that. So we are aiming at, a regional ambition, but local actions to pursue, even much more aggressive pathways. And then we met in Thimphu in Bhutan in 2024, last year. And then we came up with an action plan, 10-point action plans, how to take this roadmap forward. So there, in the process of the discussions, the suggestion was to include finance. So now we are going to have the 3rd dialogue, the science policy finance dialogue in Sri Lanka sometime this year. I think it's set in June. So concrete actions that we have taken already is 1, we have agreed to form technical committees. Now I'm glad that representatives from our member countries are here, from Pakistan, from India, from Nepal, and from Bangladesh. I don't see, but I think they're probably attending online. And from Bhutan, I am representing because nobody else is here from Bhutan at the moment. So what we have done is we have already come up with a framework that would take this process forward. So technical committees, and the technical committees met just last month and came up with a proposal to set up 3 working groups. 1 working group on monitoring, 1 working group on solutions, and another working group on finance. So with this process, we're going to take this forward in the Hindu Kush, Himalaya, in the Gangetic Plains and Himalayan foothills. I'll stop here right now.
Thank you, Pema, and really good to hear about some of the concrete examples of how you're bringing countries together to interact and advance cooperation. I'd now like to turn to Ashwin. I know we heard about the health sector contributions and engagement before, but as a kind of active health professional and also former health commissioner in New York City, would be curious to hear your perspective on how you think the health sector can engage more in air quality management.
And I can see a lot of tired faces out there, and lunch is there, so I'll try to keep it brief. New York City is a wonderful place to do work like this because it is obviously has scale. It has quite a bit of control. Our governance is much stronger than many other cities or city-states. And obviously it's had ambitious leadership over the years. Some of you might know in 2014, we signed up to an 80 by 50 pledge, right? To reduce greenhouse gas emissions by 80% by 2050. And this is, I'll pick up on the theme from this morning, which was really, you need grass-tops design and policy and ambition matched up with grassroots action. And data is honestly the thread that I think connects it all. So with that 80 by 50 plan, you see a wide-scale roadmap, fairly high level of how to get there, what kind of industrial practices and energy transition, and of course, resilience needs to be built into the city. But at a much more granular level, from that, we built the largest urban air quality survey in the world. I think London might be now neck and neck with us, called NICAS, which is a series of about 10,000 low-lying sensors in New York City. And why do I say low-lying? Because obviously we've got a lot of tall buildings, and the federal government runs those sensors, the EPA sensors. So you get a wide-scale view of air pollution in the city, but we put these sensors down on schools and bus terminals and truck depots to get a much more granular sense of where there was point source emissions and where we could do more micro-targeted both policy and regulation and of course organizing community actors and investment into those community organizations. So from that work, you know, you can get it down to the zip code or even sub-zip code level of which communities are being affected more by air pollution and how to overlay that with things like extreme heat and tree cover. And we've created a composite index based on, you know, the social vulnerability index. We created a heat vulnerability index, but that has overlaid to it also air quality metrics. All of this is open source on the environmental data portal and a part of the climate and health pan. But the health sector then steps in, and all of this is run by the health sector, health department in New York City. So it's not run by the environmental or the Environmental Protection Agency or the Office of Climate Change and Environmental Justice. And that's in part because health, in addition to having the outcomes, which can be used to organize and generate advocacy and push for change, also has the analytical capabilities and the epidemiologists and the statisticians, much more so at least than many other sectors of government. And so on the basis of NICAS data and all these other data, then using that to do things like local control of truck emissions and putting into place truck idling rules and working with our state partners to mandate as a part of commercial licensing the implementation of governors and shutoff devices within trucks. It sounds small, but actually has real and immediate impacts at a local level. And sometimes we go too far, right? Sometimes we look at things like grilling and barbecues and charbroiling. And yes, you can sort of trace that to small emissions and small changes in emissions, but we sometimes don't think enough about the externalities and the quality of life changes. But laddering up, then you start to look at which sectors are contributing. You know, you all know the health sector, the healthcare sector contributes about 4.5% of global emissions. In the United States, it's 8.5%. And in 2022, we signed on to the former president's health sector climate pledge. And I think on the order of 4 New York City hospitals signed up to get to 50% reduction in greenhouse gas by 2030 and net zero by 2050. Again, all adding up to kind of forms of health sector leadership, both on the public health side as well as the healthcare system side. And lastly, I've been practicing medicine in northern Manhattan for 15 years. And we have a catchment area that includes northern Manhattan, much of Manhattan, but also South Bronx and into New Jersey, of course. And I do adult medicine. And almost all of my uncontrolled asthmatics have come from the South Bronx, which, as I described this morning, is a neighborhood in New York City with one of the worst chronic air quality issues in our city. And so, to Mikhal's point, this is an opportunity for, and we've seen this at a local level, organizing around this lived experience of taking care of patients every single day and being patients and having patient advocates like the person who was on stage this morning saying, this is happening in my life today. And I think, once again, it's this kind of matching up of grassroots advocacy, action with data, combined with this ambitious kind of 80 by 50 goals that is a defining feature of what we can do going forward. And, you know, I think that forums like this are a great opportunity to lift these things up. I'll just end where I ended this morning. Ultimately, we will have to follow through. We'll have to keep building and keep putting into place the solutions faster. We will have to really look internally at our own regulatory structures and say, how are we slowing this down? How might we, well-meaning people who care about these issues might be slowing this down? And ultimately, the results. We need to be accountable for the results.
Thank you, Ashwin, for reminding us that it's an ongoing process and we need to kind of keep ourselves accountable, and this is a good moment, but lots more needs to be done. Aoife, we heard this morning from Christian about the importance of the private sector, and I know that at the World Economic Forum you've been engaging a lot with the private sector on air quality improvements and air quality awareness amongst the private sector. What role do you think the private sector can play?
Thank you, and I'm very aware I'm standing between you and lunch, so I will be short and sweet and very happy to speak to anyone afterwards. I just want to start off by saying it is amazing to be speaking to a room who actually understand air pollution and what the issue is. Because in so many rooms that we go into, and I think we really need to take this away to be the air quality ambassadors and constantly, similar to what I do at work, wave the clean air flag and just keep reminding people this is an issue, this is important, especially for the policymaker economic side. So as we've heard multiple times today, air pollution is an issue that is unequal. And in particular, when we think about businesses, every business has a footprint and every footprint has a supply chain. So when we start to even look at the map and start to look at the countries that are often unequally affected, in particular the health impacts, a lot of those hotspot areas are resulting around factories, they're resulting around industry. And then we start thinking about the sectors. And for example, with the WHO pollution pods, definitely encourage a little look around because this year it's divided into different sectors. So you can really play around and feel the sensation of the air quality. So that's a bit of the background as to why private sector is important. It comes to the action, right? It's like, so what can we do about it? So in 2021, the World Economic Forum launched at COP26, I think it was. World Economic Forum, first of all, for those of you who don't know, is a public-private partnership. It's a forum to bring people together. And that particular year, it brought together partners from the civil society, so CCAC, our colleagues. It brought together the private sector, and IKEA was our flagship and still is very much leading the way of we need to do this and we need to do this fast. Stockholm Environment Institute is our academic partner, so we have a fellow who works very closely with us on the technical side, and our philanthropic organisers, Clean Air Fund. So within the four organizations that was launched at COP21, and it's grown to include over 22 multinational organizations, companies, which actually has quite a large net turnover of $880 million. So it's quite significant. And I would say one of my calls to action is not to forget the private sector when we're here thinking about air pollution, in particular the sectors. So this was launched not only just as a commitment, but actually a call to action. So how can we get companies to start reporting on their air pollution emissions, which is not an easy ask. So through the technical expertise of Stockholm Environment Institute, through our work with IKEA to understand how business works, and through CCAC, who understand the environmental side, a guide was produced, which is freely available online, for companies to start looking at reporting on their global supply chains of air pollutions. This has proven challenging and, however, very exciting. So we've had, we're in, for some companies, the third year of reporting. For others, it's coming up to the first year. It's taken a bit more time to get it off the ground. But having said that, there is still a lot of improvements that we're seeing and making and doing. And just to give you an example from one of the Alliance members, he said that this really reminds him of what greenhouse gas emission reporting was 20, 30 years ago. So we're really at this start of, okay, we need to do this, we need to do this quickly, and how can we get you to be ahead of the game? And also, how can we bring policy along so we are improving all of these aspects? So I'll just finish off, because I'm very aware it's lunchtime. But I think I'll finish off with three reflections I've been thinking about since yesterday. So excuse me for repeating myself, but it's a common theme that I'm noticing with this panel as well. The first one is a quote, I can't remember who said, we really need to use our head, our heart, and our pockets. I thought that was really interesting. I think all of us in this room here use our heads. That's why we're at this conference. And WHO have done an amazing job of bringing the heartfelt conversation into play with the art, the music, the dance, with Rosamund and Ella's story yesterday. So we really also need to think about the pocket, and as the World Bank presentation has shown, we need those collaborations to start shifting the money towards where it needs to be. The second reflection I have is around silos. We really need to break out of our silos. I say this as someone who's also a medical doctor, and I am thrown in the deep end daily. But I think it's good. It's where you grow, it's where you learn, and it's also where you begin to think about other people and how they think. And the third thing is the call to action that we've heard across the board. So really, it is time for us to bring sectors together to move the needle and to identify those acupuncture points. Thank you.
Thank you so much, Aoife. I don't think I could have summed up the discussion better than that last point at the end. So with that, I'm not going to keep everyone from lunch, but just say a big thank you to all our panelists and just emphasize the call to action and the message of collaboration across sectors, across